In this week's Coach's Corner, we have our very own Tina Riordan, who is an athletic trainer, and today we're going to be talking about injury prevention strategies, injury recovery strategies, as well as kind of mental barriers that we are going to have to overcome when we are dealing with injuries of any kind. Before we dive into that, Tina's going to give us a little bit of her backstory, why she got into athletic training in the first place, what she's doing now in terms of how she's serving her athletes. We'll kind of take it from there. So
cool.
We should dive in.
Yeah. So as many people, everyone in the group may have, hopefully not, but possibly suffered an injury at some point. So when I was in high school, I was playing a powder puff football game. It was supposed to be flag football, but it definitely was not. So I actually suffered an injury and I dislocated my kneecap. So that was fun. And since that first incident, it happened multiple times after that. So I had multiple incidences with that. And then I also had just random other injuries that kind of stopped me from playing sports. So I played 3 sports. I was field hockey, softball, and then I danced. Tried basketball, but waste of height. It's okay.
I can attest to that.
So I was brought into the athletic training world because I got super close to my high school athletic trainer, and just working with other physical therapists and whatnot. So kind of navigating through those injuries. And I love sports and I loved injuries. Well, not injuries, but how to get back through them. Yeah. So I was like, oh my God, this is a career I can do. Sure. So I ended up getting my undergraduate degree. That's where I met you. Right? Yeah. And then I continued school, and then hopefully continuing further as well.
Definitely continuing further.
So yeah, that's kind of how I got started. So I work for a gymnastics team right now, and they are by far the toughest athletes I'll ever meet. And so I work with them, pretty much doing any acute injuries that happen like right away or more chronic, that happen over time, over the season, or that they've been dealing with for a while. And, I was fortunate enough before I started working with the gymnastics team as I also worked at a physical therapy clinic. Yeah. So I saw people who were very young, like 7 or 8 years old, to people who were well into their 90s.
Wow.
Yeah, so I've seen...
spectrum.
Yes, yeah. So it's cool to still implement injury prevention and rehabilitation and in regards to their physical activity level, what their goals are. Yeah. So yeah, that's kind of like my spiel. Yeah.
Before we dive into injuries, you mentioned 2 words I think that are worth dissecting.
Sure.
Acute versus chronic injury.
Yes.
Because you'll see a lot in this video. Obviously, we're not going to talk about one specific injury like a dislocated knee. It's going to be just like general injury prevention recovery strategies. But within that, acute injuries being what? Chronic being what? Can you explain the difference between those?
So acute is like within a instant. So it's very sudden. It happens. You're walking down the street, you see a cute dog, you turn, you look, and you accidentally sprain your ankle.
Accurate.
That's an acute injury. Chronic is that like long nagging pain that you've kind of felt over time, progressively kind of got worse. And it can develop, you could be kind of feeling it for a little bit, and then all of a sudden there's kind of like that one day that you're just like, this other, yeah. But I pushed it just a little bit more. But it happened like gradually over time.
Okay.
Yeah.
That makes sense. Okay.
Yep.
With that in mind, let's talk general injury prevention strategies. So,
Yep.
Obviously it's not like one hyper-specific, how do you prevent, this dislocation or whatever.
Mm-hmm.
But almost like what are some mistakes that you think people make in general with how they're approaching their workouts, warm-ups, things like that lend themselves to a higher likelihood of being injured?
Sure. So regardless of whether you are an athlete or a non-athlete, there's ways to pretty much allow your body to prevent injuries, in a sense. So whether, acute, obviously, you can use like neuromuscular training and whatnot for an ankle sprain, for example. But at the end of the day, if something happens in an acute setting, right? So, you could get hit by a ball and you could have a response to that. So, in regards to acute injuries, it's kind of like it's out of your hands sometimes.
That makes sense, yeah.
However, you can do more preventative strategies. So like you talked about, warming up.
Okay.
That's crucial. So a lot of people you'll see them do, like the...
That's right, I didn't pay her to say this. Totally didn't ask her to mention the warm-up at all.
But you see people at the gym or before, you're running a race or even, just kind of doing a little yard work or something like that.
Sure.
People will just kind of be like, oh, all right, here we go, do the neck, and then they're, all right, let's go. But what they don't realize is that the main purpose of warming up is to literally increase body tissue. So, when you exercise or increase your physical activity with whatever type of exercise that you're doing, your body increases the demand of oxygen and blood flow and everything like that. So in order for you to perform, the way that I always tell my athletes this, if you could control anything to perform better, would you do it? And they say yes. So I said, why are you skipping your warm up? And they're just
my spiel with the food scale.
Right,
If you could do anything to lose fat, I would do it. Weigh your food. That's accurate. I like that.
So when you warm up, right, it's literally, there's technically two types of stretching. Okay. There's static, and then there's more of a dynamic ballistic type of warm up. Static, right? It's when you kind of hold and reach your toes, come over, hold like this for 30. So it's that you put a joint to its end range of motion. Okay. So I'm going to try and touch my toes as much as I can. I'll stay there. There's so many contradictions, whether it's 30 seconds, a minute, regardless, you're holding at that end range of motion for a duration of time. And that's great for lengthening the tissue muscle. Okay. However, that's not what prevents injuries. Injury prevention in regards to warming up is based off of increased tissue temperature. So when you do more of that dynamic ballistic workout where you're going through a full range of motion.
Like the one-eye program?
Yes, that one. I think I wrote that one. I'm just kidding.
Jokes.
That way you're getting the body ready, right? Because whether you're doing a squat, right? You're bending at the ankle, you're bending at the knee, you're bending at the hip, right? And you're going to have some upper body, stability-wise, making sure that your trunk isn't going forward. Sure. So is sitting and just keeping every joint straight, touching your toes, going to warm up any of those joints? There's no hinge or anything like that. So I think a lot of people, kind of look at the sit and stretch as the go-to because you're I'm lengthening my muscles. However, it's more of that ballistic warm-up that will kind of help increase tissue temperature. Okay.
So more so the dynamic stuff, ballistic, prior to the workout.
Yes.
Recommendations, so I'm curious your thoughts. I would typically say if you want to do static after the workout, focus on problem areas. Are you in line with that? Is there anything that you would approach differently, or what would you think?
I feel so problem areas for sure, but then I also think that you shouldn't let other areas slide at the same time.
So give them a little attention, be proactive.
Yes,
Stretch once a year like I do. Okay.
I'll get it later, don't worry.
Thoughts on... Okay, so that's pre-workout. And we're saying workout specifically, but I'm so glad Tina mentioned, even doing yard work, there's so many activities that we dive right in. We're going to move a couch, and we've been completely stiff for 4 hours. Let's just bend over and pick it up. And I'm not saying you have to do the world's greatest freaking stretch before you go gardening, but at least getting moving a little bit prior to diving in is really important. So those are some big picture, almost, I won't even call them pre-workout, pre-activity strategies that you can do to reduce... although Tina said a lot of these are technically out of our control, we can at least give ourselves a fighting shot. Another thing worth clarifying, we're saying injury. This is also just general pain, discomfort, right? It doesn't have to be a dislocated patella.
Right.
It can be something that's a little more minor. It's an achy shoulder type thing.
Sure.
But okay, so that's the stuff that's beforehand. What about when you're actually executing the workout activity? I'm curious if you have any thoughts on weight selection, exercise selection, anything like that in terms of ways to reduce risk of injury.
So one thing that I have definitely learned from you as well, just within the athletic training world, is do less than you think at first. Okay. Check your form. You know what I mean? And I think form is the most crucial aspect to it. And then something obviously with your program Technique Tuesday, allow someone
I actually didn't mention that one.
Well, it's so crucial, right? Yeah. Because me, for example, you've seen people will post videos and you're I crushed that, and then there's little things that you don't realize doing it, but someone can visualize it, and just tweaking one little thing can take tension off of a muscle, a joint, anything of that sort. So it's following your technique is one, right? Sure. Weight selection, do not overdo it. You know what I mean?
Anything that you would look for specifically in terms of your metric of I am definitely doing too much here?
Well, definitely utilizing your ability to leave a few in the tank. Okay. You know what I mean? I think that's a phenomenal way to look at it that you've kind of approached. because at the end of the day, it's not like this do or die situation,
Sure.
you know?
So
And
true.
yeah, like the body is going to adapt regardless of whether you're using 15 pounds or 20. Obviously,
yeah.
like your muscles are going to go through little micro tears, and then that's how they build strength, and it's still going to adapt regardless. So if you're overdoing it and you're using that 20 and you're struggling, but you can kind of do it, your body is going to adapt to try and push that 20 pounds and end up injuring yourself.
Sure, yeah.
So you might as well just stick with that 15, do it well,
Yeah.
and then slowly work your way back up.
That's a great point. So it's almost like you need a smaller dose of exercise than you think to get like what's called the training effect, so like the benefit from it.
Yes.
Okay, fantastic. What about exercise selection? Anything specific, or are there ever exercises that you would say like, okay, always stay away from these? Any that you say you definitely should be doing? You fall somewhere in the middle? What are your thoughts?
So I think in regards to any exercise, I think that if it's in a controlled environment, I think it's great. So I was actually just talking with your mom earlier,
Cool.
and we were talking about Zumba and all these like high intensity workouts, or people will have all these opinions on CrossFit and everything like that. And I think the exercise itself isn't bad.
Yeah.
It's just the speed that you're doing it,
Sure.
And your form. So
Okay, yeah.
I think I was talking to your mom earlier, and I think it's beneficial to train outside of a plane, right? So kind of like dumbing it down just a little bit to understand, like your body has different planes, and we usually only train in one, right? You're going to do bicep curls, but
Sure.
like what about anything out here? You know what I mean? So we were discussing like turning your foot out and doing more of like a side lunge or something like that. And I don't think necessarily any of those are bad.
Yeah.
I think they just should be controlled.
Yeah.
And they shouldn't be in like a quick motion movement, because that's when you're going to get fatigued, and that's when you're going to kind of twist the wrong way.
Yeah.
And then
That's a good point.
in
When the
regards
fatigue,
yeah.
Like so, when fatigue becomes the objective instead of execution.
Yes.
Higher
Then
risk of
that's
injury.
without a doubt. Yeah.
Okay, I like
Yeah.
that. Okay,
Yeah.
so let's run through like the proactive strategies that we
Sure.
went over. We talked a little bit about the dynamic warm up.
Yep.
Giving yourself a chance, your body actually like raising its core temperature. It helps lubricate the joints, helps you move a little bit better, primes you for activity. We had talked about weight selection.
Yep.
So making sure you said like leave a couple in the tank that
Yep.
way, like, and keep in mind you don't have to do as much as you think, so you can kind of reel it in a little bit so form doesn't break down. Exercise selection, you had a unique viewpoint that I loved, which is that it's not the exercise itself, which is kind of arbitrary. It's how you execute it, right? So like a deadlift that you think, or a squat or a shoulder press that's like, oh, this may hurt my shoulder, may just be an execution thing. So instead of ruling out, oh, this lends itself to injury, it could just be like, okay, let's pronate your wrist a little bit.
Modifications all day. Yeah.
Yeah, we could have a whole video on
Yeah.
that. Okay, that's fantastic. So let's talk, like you said, inevitably we've all had some experience. And again, we say injury now, but like just general pain, discomfort,
Sure.
like little pulls and strains
Oh,
and
for
stuff
sure.
like that. Big picture strategies, and again, this is a little tricky without a specific injury in mind, that lend themselves to better recovery. Anything that you think that people typically do wrong when they're recovering from an injury? I'm sure you have some opinions on that.
Well, always it's pushing yourself way too quick at
Okay.
the end of the day. I think that, right? So if you're, physically active and you get kind of like that personal drive out of it, you like being in the gym, you like seeing progress, and whatnot, it's like you want to be there and you want to be back.
Cool.
So I feel like in regards to doing that, I think people tend to push themselves way too quickly in the injury process.
Sure.
Or like you said, like if it's just aches and pains.
Yeah.
So it's your body is going through something, like adapting to whatever it is that happened, and you have to listen to it. You know what I mean?
I'm gonna cut you off real quick.
Yeah,
here.
yeah.
Specifically, like how do you know like when you're ready to go? Are there any certain things you're looking for in terms of, is it okay to push through a little bit of discomfort? Like at what point do you feel like, say somebody's willing to be patient,
Sure.
but they're like, when do I have the green light? Like what are some things that you'd look for with an athlete?
So depending on obviously whatever it is, I think if you're able to move the joint through like full range of motion, let's say you had like elbow pain or shoulder pain, like are you able to go overhead without any pain? And then at that point, are you able to do stuff with like low weight? And then at the end of the day, are you able to do like activities of daily living?
Yeah.
You know what I mean? Because I see, especially with athletes,
Yeah.
they will push themselves so hard out at
Especially
practice.
gymnasts,
Yeah, but then they can't walk up the stairs, and I'm like, that's flipped. Like, you know what I mean? So it's like they think they can push themselves,
Yeah.
but then all of a sudden you're gonna go home and try to bring groceries into your house and still be in pain. It's like
Yeah.
deadlifting at the gym isn't worth you not being able to walk upstairs or get out of the couch,
Sure.
to, go get something. So, I think being pain-free in like daily life first, And then if you're able to kind of do that, are you able to go through a, warm up properly?
Sure,
Do you have any pain? And I think there's kind of levels that you can kind of hit.
Love that. Okay.
Yeah. And then after you can do the small things that are actually the big things, daily living, warm ups. Are you able to pick something up from, the table without any shoulder pain, or squat and kneel and play with your kid or stuff like that? Then slowly implement lifting back in, whether that's starting body weight and just seeing whether you can do that, and then slowly adding more weight. And just because you have to start small, let's say you were deadlifting 150 and you're just doing the bar, you're doing more than you were yesterday. So it's
I love that.
Yeah.
I like how, as you know, I love running things through filters.
Sure.
But how it's earning the right to the next layer of activity.
Love that.
Because that allows it to be, and I'm learning right now, purposefully ambiguous in that instead of saying an arbitrary, at 2 weeks you're cleared for activity, is your day-to-day fine?
Yeah.
Can you get overhead? Can you reach to the back of your closet? Like you said, can you play with your kids? Cool.
Yeah.
Let's head into the gym. Let's do some light warm-up stuff, maybe your dynamic warm-up. Can you even get through that without pain? If not, you probably shouldn't be loading your body on top of it. To your next point, body weight type stuff, moving through a lower load or dosage of exercise. And then if and only if that feels good, moving on. And to kind of add two little thoughts here, little side notes. Unless you're competing in an exercise, so a power lifter is kind of work through bench squat deadlift or something like that, or unless you're running and you actually have to hit the pavement at some point, there's virtually no upside to driving through I need to hit my sumo RDLs. It makes no sense to do that. You can get similar benefits from working around, and understandably there's a mental barrier to that, which we'll talk about in a second. But again, my 2 cents here, know that physiologically you can have a very small, infrequent dose of exercise and still maintain a certain level of fitness. So in terms of the order, you might find this interesting that it goes first. If you just were a couch potato starting now, you have your cardio and conditioning is going to go first. So and we've all experienced that. You take a little time off, you walk up the stairs, you're gassed. So that goes first, but it's also the quickest to return. From there, flexibility is going to go. After that, we have muscular endurance, and then finally we have muscular strength, and those being the 4 main components of exercise. From a strength perspective, we're looking at these exercises that a lot of us push through. You don't need to. You could quite literally do 2 sets at a moderate intensity every 2 weeks and still maintain your strength.
Wow.
So when we're looking at it from I feel like I'm losing all my fitness. You didn't get in shape in a week or 2 or 3 or 4, even months. It wouldn't make sense that you'd fall out of that. So mentally, and again, this is what we're about to dive into. It's understandable, but know that the physiological side of things does not lend itself to you jumping the gun and rushing back to activity. Let's talk mental.
Sure.
You see it at the most extreme level where there are such barriers for, I'm talking gymnasts specifically, or psychos, and I mean that, and I'm impressed. It's a good way. Where they feel like they're not doing enough, they feel like they got to get back sooner than later, they feel like they're withering away, getting out of shape. What are some things that you see? What are some strategies that you recommend? I mean, again, athletes, but that's an extreme level for us regular people to bust through those barriers. What do you say?
Well, for me, for you, for the regular
non-psycho gymnasts.
Love them to death. But it took us a lot to get to this point, right? So you go through those times where I'm trying to lose weight and it's just not working. Then you give up, and then all of a sudden you're in this good area of your life where you're going to the gym, nutrition's in check, and all of a sudden, oh my god, an injury happens, or oh my god, my shoulder just kind of hurts today, and then all of a sudden it's just stop. So it's psychologically, I think it takes a lot for an individual in today's society to get into that sweet spot and have all those, you know what I mean? So psychologically, all of a sudden it's taken away from you so quickly, whether it's over time, chronic, or acutely, you get hurt in the gym. So it's almost or not even in the gym, maybe you're outside or something random, but then this whole entire thing that you've been working for psychologically, maybe your entire life, that you finally feel you hit the sweet spot, is taken away. You know what I mean? So you're kind of just almost a loss of identity. I see that with athletes all the time, right? Because that's their main job. And then all of a sudden they can't do it, and then they're I don't feel like me. But for someone like us, every single day, some days we're we don't want to go, but we go, and we're in this sweet spot, and we're cruising, and we have this momentum, and then it stops. So psychologically, it's almost we're losing that identity that we just tried to build. And I also think
that's great. You articulated that really well. That's great.
Thank you. But I think that psychological component is just awful. So then I think, as we kind of all experience, we almost shut off that light. We're just all right, we're done, we're out of the gym, we can never go. Even if you hurt your foot, you can sit on a bench and like do all upper, but psychologically you just shut it all down.
Yeah.
And so something that I think you do a great job with discussing is kind of like not a on or off light switch, it's like that dimmer, right?
Yeah.
So, and I'll let you kind of touch base on that, but psychologically it's still allowing yourself to go to the gym.
Yeah.
You might not be able to do a few exercises, but getting yourself there and, you know, controlling what you can.
Love that. You're nailing that.
But obviously you're losing the mental aspect. So physical, you know what I mean? But once the mental aspect goes, it's kind of like, it's hard to gain back that momentum. So you were talking about your 4 layers.
Sure, yeah.
But there's a mental aspect to it too, you know what I
Sure,
mean?
yeah.
And that, the body is, you know, our muscular system and skeletal system, like that heals on its own time.
Yeah.
But like mentally, it's so hard to be in control of that.
Yeah.
And so I think that when someone's injured or going through aches and pains, and you kind of have to adapt to that.
Sure.
But I do think it takes time, and you need to have like the right people around you to kind of help push you in that direction. You know, if I've been hurt before, and I remember I was like, I'm not going, but you were just like, do uppers, you know what I mean?
Yeah.
And so we did. And so sometimes you just need someone to remind you that like you can push through those mental barriers just as much
Sure.
as you push through the physical.
I love
Sure.
that. Okay. So in terms of focusing on things within your control.
Yeah.
So you mentioned like, okay, say my lower body's hurt, I can still do upper.
Sure.
Any non-exercise things that you think people like neglect in terms of like things that will like move the needle in recovery and like, you know, that can break through that barrier because you feel like you're actually making progress? Like anything specific?
I mean, I think that regardless of whether you're talking about injury, aches or pains, or actual like fat loss,
Yeah.
like I think sleep, nutrition, like hydration, all of those are going to play a role because then your
Yeah.
body's going to feel better as a whole.
Okay.
And if you're feeling like not so like down in the dumps, like, ugh, like I just don't feel like myself, like those are all within your control that you'll kind of feel like more like upbeat and like,
Yeah.
all right, like maybe I'll just do, you know, go for a walk or something like that.
Yeah.
Something small, just get your body moving.
Yeah.
So I think those little things help psychologically because then you feel a little bit more yourself,
Yeah.
whether your body can take it or not.
Love that.
But yeah, I feel like those would all play
Yeah.
an impact.
Yeah.
on
It's
that.
almost like reallocating the time and energy that you have been spending on an exercise or an activity you may not be able to do now
Yeah.
toward those other things.
Yeah.
Okay, that's fantastic.
Yeah.
I like that a lot. And the other thing you had mentioned that I've never heard, which I really like, how much your environment plays a factor in your ability to kind of cope with whatever you are dealing with. Any strategies for almost like enlisting the help of friends, family, like anything, like conversations that you'd recommend having, ways to get that support when you are like battling through something?
Sure.
Like, what would your go-tos be?
I mean, I think it's everyone has had aches and pains before. They've been out of something because they hurt themselves. So just like talking about your injuries, like I'm sure you and I could talk all day about, you know.
For sure.
Anything.
Anything.
Yeah, well, that too. But everyone's kind of gone through it. So just talking about like being hurt, not being able to like do what you want to do, or, you know, whether it's in the gym or out of the gym, it's frustrating, right? Because
very.
we want our bodies to be able to do like all these crazy things. And sometimes it just doesn't want to do it. So I think talking to people, like social aspects, and then they can help you push yourself as well when you're ready.
Sure, yeah.
When you're ready, you know what I mean? So it's like mentally you might just not be in it anymore. But when you're ready physiologically, like your injury or aches or pains have kind of gone away, it's like sometimes it's that mental barrier again. Like, I don't want to go back to the gym. You know, I got some cinnamon cake rolls over there.
Yeah.
Like, I'd rather, and then kind of, right, it's emotional eating at that point too. And that's a whole different issue.
Yeah.
I've seen
a full-length
so many
video.
athletes kind of like go into that. But yeah, so I think having kind of like social accountability for sure. Because sometimes we've all been there. Like, we just get to that point where we just take a step back and we're done, whether it's you're not hurt at all and you're just not in it, or you have that injury that kind of your identity is kind of taken away from you. So I think having people holding you accountable and just helping you talk about it and talk through it, I think it's super beneficial.
Yeah, and actually like, asking for that accountability.
Yeah.
Speaking from experience, it was like a month and a half ago now, I had some like weird mystery sternum injury, whatever. And
I couldn't even figure it out.
Yeah, we couldn't. Yeah, we anyway. And I would fairly regularly reach out to Tina and be like, and because at that point I couldn't like really do a lot with upper body, and like I was definitely discouraged because I felt like I've been hitting a stride with workouts. Just training lower body like a lot, and like that gets exhausting, like not just physically but like mentally draining. So there would be days where I'm like, I don't want to do anything, and I was just like pity party for my chest sternum thing, whatever, and I'd be like, yo, if I don't hit you up in an hour that like I'm at the gym, I need you to like call me out for it. And knowing that I had Tina on the other end and be like, hey dummy, you get your butts to the gym yet? I'm like, fine, I'll go. Like that's all it took was like a little push. And the flip side, obviously I'd be happy to help her with the same thing. So I like that, actually asking and not just venting, but like, okay, yeah, this sucks. What are you gonna do about it?
Yeah. Oh,
like,
without a doubt.
Because you challenge me with that all the time. I'm like, my sternum. You're like, what are you gonna do? So actually asking for that. So in terms of overcoming the mental barriers, we're looking at focusing on factors within our control.
Yes.
Moving the needle in other areas that aren't just the exercise thing. For the idea of just unbroken momentum, just like I'm gonna do something because it's hard, because mentally there's upside to that. And then asking for support, asking for social accountability. Like, Tina, make me go to the gym. Like,
I feel like people are so afraid to do that, and I do not, because it like shows weakness. But it's like.
But it's always a reciprocal thing, right? Like, and anything, like asking for help is a compliment to the person that you're asking. Like I could ask anybody to get me to the gym. I go to Tina every single time. Like that's a compliment to her because I know she's super reliable and following up, and like I trust her and care about her, and like that gets returned. And then on the flip side, people are gonna want to reciprocate. So if you're asking them for help, you'll gladly do the same thing for them. So it's not like the
without a doubt.
It's not like the pain that you think it is. But so there we go. We just went over some injury prevention strategies, injury recovery strategies, overcoming mental barriers, without ever actually talking about a specific injury. So bravo to Tina. That's fantastic. So if you guys are going to the December 20th event, you'll be fortunate enough to meet Tina in person. But for today, thank you so much for being a part of this. Appreciate you as a person. Appreciate you as a friend. And we'll chat. Cool.
If also before you stop, if any of you guys do have any questions, or I know I've talked to a few of you guys about injuries that you guys had and or working through. So if you have any questions, please feel free to message me.
Very lucky to have her as a resource.
But yeah, so I'll see you guys in December.
Sounds good.
Cool.
Thanks.
Thank you.